Can you lose your eyesight without any symptoms? Glaucoma is one of the leading causes of blindness worldwide, and yet many don't know they have it until it's too late. Now, there are many different types of glaucoma, but in general, glaucoma is an eye disease that damages the optic nerve, typically due to elevated intraocular pressure, causing permanent vision loss. And the scary part, it typically happens very slowly without any pain. Now, much like a car tire, how it has air pressure, all eyeballs have pressure as well. Internally inside the eye, we produce a clear fluid called the aqueous humor, and an equal amount of that fluid needs to exit out to maintain a normal eye pressure. Imbalances in the creation or the drainage of the aqueous humor can lead to elevated intraocular pressure, leading to the development of glaucoma. So, how do we treat glaucoma? For a moment, I want you to imagine your eye like a sink in your house where there is a faucet that puts fluid into the sink and a drain that takes it away. When we're treating glaucoma, we can either turn down the faucet or we have to increase the outflow of that fluid. We have eye drops that can do just that, and that is the first line of treatment for the average glaucoma patients. We have drops that can actually reduce the amount of aqueous humor production as well as increase its drainage. The average glaucoma patient does very well on just topical eye drops. We have a newer medication that was approved a few years ago called Durista, which is a tiny implant that we put in the front chamber of the eye. Over time, the medication is released and it can help control the intraocular pressure, and it helps reduce the need for a patient to use eye drops. Like all medications, patients can be allergic to glaucoma medicines, or they can't tolerate them, or plain and simple, we're not hitting our target pressure. So we have to consider other options, and one of those options is called SLT, which stands for Selective Laser Trabeculoplasty. It's a very safe treatment. We do it in the office, and what happens here is pigment from the iris flakes off and can get stuck in the drainage system of the eye. The laser targets the pigment cells in the drainage system, removes them, and allows for better aqueous humor outflow. We also have what's called MIGS, which stands for minimally invasive glaucoma surgery. Now, these can either be done standalone or we combine it with cataract surgery, and we call it a combined surgery. These can include intraocular laser treatments, surgical opening of the drain, and we have a variety of different stents that can be placed in the drainage system. These treatments are not only effective, but they allow for a very quick recovery time. Now, some patients have advanced glaucoma. We can't control their pressures very well. They have advanced vision loss, and we are not getting good control either with topical eye drops and with these mixed procedures. And then we now have to consider what's called tube surgery. This is completely different, where we're creating a separate drainage pathway for the eye. A tiny tube is placed in the eye where aqueous humor can then flow and is actually put in a different part of the eye where it can then be absorbed by the body. These are a very effective treatment for lowering the pressure in the eye, but they are longer surgeries and there are more complications involved with these surgeries. And these are only reserved for more of the advanced glaucoma cases. So one thing to remember when it comes to glaucoma treatment is glaucoma damage is permanent and we cannot reverse it. The goal of the treatment is to stop further vision loss. So the bottom line is glaucoma is a sneaky but very manageable eye disease, especially with early detection. So regular eye exams is your best defense against losing your vision to glaucoma.